We want to welcome everybody to our second session of our data management series put on by the Rocky Mountain Tribal Leaders Council and also the Centers for Disease Control. Thank you so much for our guests from the CDC. We are really appreciative to having you here. We really love the expertise that you are bringing to us and all the help, and we're happy that you're experiencing the 80-degree weather there in Atlanta. And want to also welcome all of our distinguished guests from our tribal entities throughout Wyoming, Montana, and Idaho. So happy to have you here today. And then, of course, my colleagues from the Rocky Mountain Tribal Leadership Council. I'm so happy that you guys are able to join us as well. Today, let's see, we are going to talk about we're going to talk about data visualization and basically epidemiology 101. And we have some exercises for all of you to do today. So make sure that you're ready to go with your Excel spreadsheets and your computer because we're going to have some exercises. My name is Jennifer Hudson-Schaff, and I'm training coordinator for the Room Tech and the Tribal Leadership Council. And I live in Lander, Wyoming, and we have, yes, about 2 feet of snow. If you ever have any ideas for training, requests, technical assistance, etc., please give us a holler, and we would be so happy to help you out. We have several presenters today, Ms. Rebecca Tsai, Kira Hall, Sundap Gunnison, and Melissa Victor. We are so happy that they are joining us virtually. One day we're going to get them out here so that we can see them all as well. I know they've been here before, but I haven't met them yet. So, but in any case, we're so very happy to have them here to provide this training for us, and we are very excited to see all the different tools that they have presented to us. Next slide, please. And I also want to remind you guys that we are going to be recording this. In fact, I got to hit the record button right now. So if you guys can click again, yep, there we go. We are going to record this session, and what we do with the recording is where's the record button? There it is. Start recording. Okay, so today's session will be recorded for future use for training purposes. So what I do is I try very hard to remove any identifying features from the recording, but it will be posted on a private YouTube channel. And in that private YouTube channel, that means that only the people who have like email access to it will be able to access it. Later on, it may be available in our new learning management system. We are now going to be with the Public Health Foundation's learning management system, so it may be posted there as well. And so by participating today, either through chat or on camera or audio, it indicates your consent to be recorded. So we appreciate all of you for participating. I will try my best to remove any identifying features after the recording is published. And next slide, please. And again, with today's training, if you could sign in for us, we would greatly appreciate it. And that helps us, keep in touch with you, be able to contact you if you have any questions or if we need any follow-up. So if you could use the chat box to sign in for today's training, please put in your name, title, organization, and your email address. You can also ask questions throughout the training by using the hand icon, which Divya did earlier, to raise your hand. You can also just post your questions in the chat box. We would appreciate it if you would mute your phone when not speaking, but you can also chime in if you need to. So like I know that there are some folks out there who are like, oh yeah, I have to be able to say this out loud. So. The use of cameras is optional. We love to see your smiling faces, but it's up to you if you'd like to. And later on, we've been using email primarily to share our resources, and I haven't done an evaluation yet, but we'll probably have an evaluation after this session. And next slide, please. And we want to welcome all of you to this glorious day, and we're going to start, as we usually do, with a prayer. Next slide, please. So if you'd all join me in this prayer, so that we would have a good start to this session. Creator, bless me this day to have good thoughts, to see good things in a person, to hear good things from a person, to talk good to a person so that I can walk with others in a good way. Thank you, Creator. Haho. And we really appreciate having all these wonderful people with us today for this session. Go ahead and next slide, please. And we are ready to go. So I'm going to go ahead and turn off my camera and watch the chat. And I think, Rebecca, you're up.
Yes, thank you, Jennifer. Can you hear me? Okay, thank you, Sundek, for confirming. So good morning, everyone. And as you can see from our agenda here, we have a lot of material to cover today. During the session, we will go over data definitions that you will often see in data visualizations. We will also talk about the importance of county-level data and show you examples of dashboards. And lastly, we will learn to create a chart using Excel. Let's start off by asking ourselves this question. What is the value of visualizing data? Well, a well-known mathematician named John Tukey said that the greatest value of a picture is when it forces us to notice what we never expected to see. Now, the same concept can be applied to data visualization. Visualizing data helps us identify data patterns that are not easily seen when just looking at raw data in tables. An unexpected data pattern could very well signal the beginnings of an epidemic. Now, the pictures on the slide may be familiar optical illusions to many of you, and you can, look at it and see, what do you see when you look at them? Data visualization can be used to highlight specific parts of your data. Now, take a look at these two versions of the same picture. The left picture highlights the side view of a young woman, while the right picture highlights the face of an old woman. Likewise, data visualizations can highlight increasing or decreasing data trends. Now, before we get started, I would like to emphasize that there are no set rules as to how a visual should look. As Edward Tufte, the pioneer of data visualization, said, in good information visualization, there are no rules, no guidelines, no template, no standard technologies, no style books. You must simply do whatever it takes. Each visual should be individually designed to tell a story. The purpose of this session is to provide the building blocks you need to start creating your own visuals. This will include preparing data for visualization. To begin, we will need to first understand some data definitions that are commonly used to describe health-related data. Now, these examples are based on COVID-19 data, but the same concept can be applied to any condition. This chart, produced by Idaho, is an epicurve. The x-axis shows the date, and the y-axis indicates the number of cases. Now, each bar here represents the number of cases on a given date. Now, we can see that in Idaho, there was a small increase in cases around the middle of summer to early fall, and followed by a much larger increase in cases over the winter. You may also see charts showing a 7-day or sometimes even a 14-day or 21-day moving average, like this chart here created by Wyoming. These averages are used to smooth out differences that can occur with daily reporting numbers. For example, a reporting lag may lead to a lower count one day and a much higher count the next day. Here's another example from the CDC COVID-19 data tracker, where both daily cases and the 7-day moving average are displayed on the same chart. Now, to calculate a 7-day moving average, first you would need to add up the number of cases for the date of interest and add that to the number of cases for the previous 7 days. So that is adding up 7 days of data that you see here. Then you would divide the sum by 7 to get the 7-day average. To get the 14-day average, you would have to add up 14 days of data here and dividing that sum by 14. Now let's look at an actual real-life example using data from the CDC COVID-19 data tracker. Now in this table, we have 7 days of data here. And in this example exercise, we want to calculate the 7-day average for April 6, 2021. Now first, we will add up 7 days of data, 7 days of case count here, starting from April 6, that is our date of interest, and going backwards all the way down to March 31st. And we can see here that we are just adding up 7 days worth of case count, which will give us a sum total of 443,853 cases. Next, we'll divide this sum by 7 to get a 7-day average, meaning there are 7 days worth of data. And this will give us a final 7-day average of 63,407 cases. Another visualization you'll often see are maps. This map shows active COVID-19 cases in Montana on April 14th, 2021. Active cases are infected cases that are still within their isolation period. Now, we can see from this map that this county here has the highest number of cases. And I have to use Google to kind of look this up, but I found out that this is the Gallatin County, which has the highest number of active cases here. And here is another example showing the number of cases in Wyoming on April 8th. Now, we can see from this map that Laramie County, which is also the most populated county in Wyoming, has the highest number of cases at 7,344 cases. And this is followed by Natrona County, the second most populated county in Wyoming, with 5,859 cases. Now, the county next door, Fremont County, where the parts of the Wind River Reservation is located, has 4,282 cases. Now, when we are looking at COVID-19 case counts, it makes sense that more populated counties, such as Laramie and Natrona, would also have higher case count because these counties have more residents that can be exposed to the coronavirus. Since population in each county can vary and also be very different, case in point, we were to compare the population size of Laramie County versus Niobrara County up here, case count is not a good measure for determining which county has the highest burden of COVID-19 infections. So this is where rates will come in. Now, this chart, also reported by Wyoming, shows the rate or number of COVID-19 cases per 100,000 population over the past 14 days. Now, we can see here that Teton County here has the highest rate of 417.7 cases per 100,000 residents, while Fremont County has 170.7 cases per 100,000 residents. Meanwhile, the most populated county here, Laramie County, has 106 61.8 cases per 100,000 residents. Now, rates give us disease frequency that considers the size of the population. This will allow us to make better comparisons. We can see from this chart that although Teton County did not have the highest number of cases, it has the highest rate, meaning that it has the highest burden of COVID-19 infections in Wyoming. Rates are particularly useful for comparing disease frequencies in different locations, at different times, or among different groups of persons with potentially different size populations. Here's an example of a line chart based on Idaho data that shows the moving average incident rate across time. This allows us to compare rates across different time points. And now we're going to look at the formula for calculating rates per 100,000. Now, a rate per 100,000 is defined as the occurrence of cases per 100,000 person in a population over a specific period of time. Now, this period of time can vary, and it can be in day, week, month, year, and etc. Now, to calculate the rate, what you'll do is that you will take the number of cases of disease, and in this case, we will be looking at COVID-19 cases during a specified period of time, and dividing that by the size of the population at the start of the specified period of time. Now, this portion here will give you a fraction. To get a rate per 100,000, you'll need to multiply this fraction by 100,000. If instead you want to calculate a rate per 10,000, so to do that, you would just take the same fraction here, and then you'll just multiply that by 10,000 instead of 100,000. Choosing what rate you want to present is dependent on many factors, including population size and preference. Now let's take a look at a real-life example. So in this example, we want to calculate the rate per 100,000 of active COVID-19 cases for Flathead County, Montana. Now first, we need to specify our period of time. So we're looking at active cases as of April 14, 2021. Next, we need to make sure that we know our area. So in this case, we are looking at county level data from Flathead County. And so we can see from this table here that there are 65 active cases in Flathead County. So the next thing we need to do is to find the size of the population in Flathead County, which is also referred to as a denominator. Now, there are multiple sources that will provide you with the population size of Flathead County, and the population estimates from these sources are likely similar but not identical. You can choose any of these data sources. However, to ensure that your calculated rates are comparable, make sure that you use the same source for all of your reported rates. So in this exercise, we'll use the data source used by the CDC COVID-19 data tracker. Now, this population estimate comes from the U.S. Census and shows the population totals from 2010 to 2019. We will be using the 2019 population estimate because the data for the 2020 population estimate is not yet available. Now you can click on this link to get to the census website. So this is what the census website will look like when you click on it. So what you would do to get the population size for Flathead County in Montana, you will click on Montana. And once you click on this, you will download an Excel file that will look like this. So what you would do here is, since we are looking for the most recent data we have, we will scroll all the way over to 2019. And we're going to go down and look for Flathead County, which is right here. So in 2019, the population size is estimated to be 103,806. So now we're ready to plug these numbers into the formula. So first, we will take the Flathead County active number of cases, which is 65, and then we'll divide that by the size of the population that we just looked up, which is 103,806. And this will give us a fraction of 0.000626. So since we want this to be a rate of 100,000, we will multiply this fraction by 100,000, and this will give us a rate of 62.6 cases per 100,000 residents. Now, this rate formula is the same for calculating other measures such as hospitalization, vaccination, or death rates. Pretty much just replace the number of cases with the number of hospitalization, number vaccinated, or number of deaths. Now, the next data definition we'll talk about is percent positivity. Now, this is Idaho's laboratory testing dashboard. On the x-axis here, it shows the week of specimen collection. The left y-axis shows the number of PCR tests performed as indicated by the purple bars. And the right y-axis here shows the percent positivity as indicated by the white lines. Now, percent positivity is defined as the percentage of all RT-PCR tests conducted that are positive for COVID-19. Now, the formula for percent positivity is simple, pretty straightforward. It is just the number of positive tests and divided by the total number of reported tests, which would include both positive and negative test results. And to get a percentage, you would multiply this fraction by 100. Now, looking at this formula, percent positivity will be higher if you have a larger numerator here, which is a higher number of positive tests, or when you have a smaller denominator, meaning that you have a smaller number of reported tests. Now, this means that you need to take certain things into consideration when trying to interpret what percent positivity means. So going back to the Idaho chart here, a higher percent positivity, as seen here, can indicate three potential scenarios. First, it could mean that we do have widespread transmission among those tested, and appropriate actions are needed to slow transmission down. Second, it could also mean that we are only testing people who are more likely to test positive for COVID-19. For example, we may only be testing more people with symptoms. So this could indicate that we're not testing enough people and that we need to cast a wider net when testing for COVID-19. Third, it could be due to reporting lags, where positive tests are reported earlier than negative tests. Now, care must be taken when trying to incorporate the meaning of high percent positivity. So the definition and formula I just provided is the definition used by CDC, which is based on the number of positive tests over the total number of reported tests. Now, or otherwise known as the test over test method. However, states and other jurisdictions may use other variations to this formula to calculate percent positivity. It can also be calculated as the number of new people with positive tests over the total number of reported tests, which is the people over test method, or it could also be people over people, where you're looking at the number of new people with positive tests and then over the total number of people tested. Now, since CDC does not have identifiable data, CDC cannot deduplicate persons who may have had multiple tests, and therefore we can only use the test over test method here. However, states and other jurisdictions do have identifiable data and can deduplicate these data, so they're able to use other measures such as people instead of just using tests. Now, let's take a look at an example, a real-life example here, calculating percent positivity. Now, this data came from the CDC COVID-19 data tracker. And in this exercise, we will calculate the percent positivity for the United States on April 6, 2021. So the first step is we need to identify, the period of time we're looking at. So we're looking at cumulative tests since the beginning and in the United States. So next, we will plug these numbers into a formula. So on the top, we will list the number of positive tests, which is about 32,750,000 tests. And then we'll divide that by the total number of reported tests, which is about 384 million. So this will give us a fraction of 0.08528. So to get a percentage, we will multiply the fraction by 100, and this will give us percent positivity of 8.53%. And as you can see here, this percentage matches the number we see on the CDC COVID tracker website on April 7th. The last data definition we will talk about is percent change. Now, percent change compares a current time point with a previous time point, which could be last week, last year, time of peak count, and etc. Percent change helps summarize the change since the previous time point and can tell us about the size of the change, whether it's big or small, and also the direction of the change, whether it's positive, meaning that there's an increase in cases, or negative, meaning that there's a decrease in cases. Now, the formula for percent change is simple. So up top, you calculate the difference between the current number of cases and subtract that minus the previous number of cases. And then you divide this by the previous number of cases. And this will give us a fraction. And since we want this to be a percentage, we will multiply this by 100. Now, for a real-life example, we will calculate the percent change of newly admitted COVID-19 patients between the current 7-day average, and this was based on the week of March 30th, and the previous 7-day average based on the week of March 23rd. So we need to make sure we know our time points. So in this example, current time point will be week of March 30th, previous time point will be week of March 23rd. Next, we're going to plug some numbers into our formula. So we'll take the current number of cases, 5158 here, and then subtract it from the previous number of cases, 4954. And then we'll divide that by the previous number of cases, 4954. So this will give us a fraction of 0.041178. We'll multiply this fraction by 100, to get the percentage, which is 4.1%. Now, this percent change is telling us that there is a small positive increase in cases compared to the previous week. So now we will move on to in-class exercises, where you get to apply what we just went over and learned about. So there will be 3 exercises. The first one, you'll be asked to calculate a 3-day average for April 4th. The second exercise, you'll be asked to calculate the rate for Gallatin and Yellowstone County in Montana. And I have the number of cases, active cases listed here. And I would also like you guys to tell me which county has the highest rate per 100,000. And the third exercise, I will be asking you to calculate the percent change between the current 7-day average, which we're going to use as March 30th, and compare that to the peak 7-day average, which happened on January 9th, 2021. So at this point, you guys should all have the Excel sheets and download the Excel sheet from the share drive provided. If not, please take some time to do that now. And I just kind of want to briefly go over the Excel sheet with you guys. So the first 4 tabs here in green, 7-day average, rate, percent positivity, and percent change are just examples or formulas that I provided. So this is based on data from the CDC COVID-19 data tracker. So the cells here in yellow, highlighted in yellow, are the formulas, calculated variables. So as you can see here, you can click on this cell to get the formula for the sum of the 7-day average. And you can see that this sum is based on the 7 case count for 7 days for April 6th. Now, similarly, the 7-day average is also a calculated value. You can combine this into one step. I just split it up so you guys could see it a little bit better. So in this case, it's really just taking the 7-day sum and dividing that by 7 to get the 7-day average. And you can see here, this is the reported 7-day average that's reported on the CDC data tracker when I downloaded the data on April 7th. So, and similar examples here, and there's calculations for rate based on what we just talked about, and I have it all set up for you guys to kind of see. So here is rate per 100,000. As you can see, you times that by 100,000, by 10,000, by 1,000. So you can just see it basically is just a decimal place moving forward, depending on what your per value is. And same thing for percent positivity and percent change. So if you scroll over on the tabs, there are many tabs, you'll see these blue tabs called exercise 1, 2, 3, and 4. So right now we'll just focus on exercise 1, 2, and 3. So I copy the data here, and you guys could just do your calculation right in Excel for exercise 1, 2, and 3. So for exercise 2, I prepare the data in this tab here, Census Montana. So you can use this tab here to kind of look up the size of your population for 2019 to do your calculation here. And for exercise 3, here are the two-day data points that I want you to look at. So I just kind of want to give you guys maybe around 5 minutes or so to try to work this out. And then one of our fellow Rocky Mountain Tribal Leader Council, Aaron, will help go over the answers after about 5 minutes or so. So does anyone have any questions so far?
Rebecca, I noticed that there's a slight error in exercise 3. I'm sorry I didn't notice before.
Oh, okay.
The highest case rate, in one place you have 16,521, and in the other it's 16,540, but either should do. to demonstrate.
Yes. So what happened was this data gets updated constantly on the CDC website. So I was trying to update to a newer data, so I may not have changed all of it, but either one would do. Just whichever. Just use this number here as an example. So sorry for the confusion.
And that was most likely my fault. But yeah, go ahead and use the numbers that are on the Excel spreadsheet.
So yeah, we'll take about 5 minutes, and then Erin will go over the answers with everyone.
I feel like we should play Jeopardy music.
We'll put that in next time.
Yeah. Let's go for it.
Okay, so we're going to calculate a 3-day average ending on April 4th, and this is pretty straightforward. We're going to sum, which means, of course, just means to add up the previous 3 days, including April 4th, and retrieve a total case count. And then to average, we will take that sum and divide it by 3 for the 3 days. And usually when we get a decimal point in data like this, we we'll just round up to, excuse me. Sorry, I'm working with a slightly different version of Excel than I'm used to, but I can decrease the decimal points to get our answer.
So Erin, you're saying that on this one, we would definitely round up, like no decimal points?
Yes, well, that's usually what we do in-house, is we don't deliver fractions of cases as numbers. We round up or round down.
Because it's really hard to like split a person in half?
Exactly.
Okay.
Okay. For exercise 2, we'll look at the number of cases in Gallatin County versus Yellowstone County. Gallatin County clearly has more cases, but we really need to look at the population to determine which one has the higher rate. So we'll go over to the census tab, which was provided for us. And mine looks a little bit different. Yours was edited to make it a little more clear. Let's see. Sorry, again, slightly different version of Excel that I'm used to. So I'm going to just copy, let's see, the population of Gallatin County, the latest one, and drop it here. Next, we need the population of Yellowstone County. So I'll go back to that same tab that was provided for us and copy that population over. Now to find the rate, we always let Excel do the work. We'll take the number of cases divided by the population, and then to change it from a decimal into a proper rate, we're going to do 100,000. And then we can transfer that rate down. You can either autofill or it popped up. Mine popped up with that nice suggestion. So now we can see that Gallatin County has a higher rate. For exercise 3, we're going to look at the differences in percentage from our current 7-day average. Let's say today we have 5,158 total cases, and the highest 7-day, sorry, not total cases, current cases, and the highest 7-day average was 16,521. So we understand that our numbers are much more comfortable, but let's put a percent change on that. So we're going to take our current average, subtract off our highest number, and then we will divide this number by the highest number, the highest 7-day average, to get a decimal of minus 0.6877. But to change it into a proper percent, we will multiply that by 100. So our percent change is minus 68.778%. Which is a lot more comfortable. Does anyone have any questions or anything that's a little confusing or difficult?
Thank you, Rebecca and Aaron. So my name is Kira. I'm an epidemiologist on the Tribal Support section on the COVID-19 response. So today I just want to go over the importance of county level data, go over a toolkit that's provided by Johns Hopkins to help visualize this data, and then also just show a few dashboards and kind of show how they show county level data. So why is county data important? So a lot of tribes don't, report their data outright. So the best next thing is that county data. So that county level data provides a better context about the COVID-19 situation for the tribal communities. And a lot of tribes are located across several different counties, so which makes that county level data very important. And then also, as far as many tribal communities will commute off the reservation areas to the surrounding counties for school, shopping, other travel-related businesses. Tribes do work closely with their local county health departments for managing COVID-19 cases, contact tracing, contact tracing, testing, and vaccination. And then also county and state data provide more detailed information, at the zip code level. And this right here is a snapshot of the toolkit that Johns Hopkins provides typically for tribal communities to help visualize their data. So this is just an example of the one from Fort Belknap. But I'm going to go ahead and pull up the Excel file with the dummy data I created and just go over what all is included in this dashboard. So once you download the dashboard, you're going to see 4 different tabs. So you'll have your instruction tab. So you'll need to have Microsoft Excel 2013 or higher to use this dashboard. And if you download it from when you download it from the Johns Hopkins site, rows 2, 3, and 4 in the data input tab will already have data in there. So you want to make sure that you don't want to delete that existing data, but to type over it. And then here is the data input tab. So I just have some few dummy data points just to show on the dashboard. And then for the dashboard, anytime you do input new data, you will want to hit refresh just so the dashboard can update. And you can customize it as far as, customizing the tribal community that the dashboard is for, and then, entering the size of the population. So on the left-hand side, you'll see that for this dashboard, you'll start with your case data. So it's going to show you the total cases, new cases past 7 days, past 14 days, rate per 100,000 for the past 7 days and the past 14 days. And then scrolling down, you'll see you have your testing data. So it's going to show you your total tests completed in the past 7 days, the percent test positivity in the past 7 days, and then also for the past 14 days. And then lastly, you'll show your hospitalization and death data. So it's going to show you the total number of hospitalizations, total number of deaths, deaths in the past 7 days, and then also your case fatality rate. And then going back up to the figure. So figure 1 is your epi curve. So this is showing the number of new cases identified over time. And then in figure 2 is showing the total number of COVID cases that have been identified since a specific date. So because this graph is going to show you the total number of cases over time, it's only going to increase and not decrease. So the goal is you want to slow down how quickly the total number of cases are growing and eventually see a plateau, which means the spread of disease has slowed down. In figure 3, it's going to show the number of positive tests by week. And then for figures 4 and 5, it is showing the number of percentages of positive cases by age and sex. And then for figure 6, it's going to show the number of hospitalizations over time. And for this dashboard, Johns Hopkins, they also have an interpretation toolkit that is linked on their website and then also put in the resource slide in this slide deck that kind of goes over how to interpret this data and create a report. Then next, this is a snapshot of the Johns Hopkins University COVID-19 dashboard. So this is an excellent dashboard as far as giving a good snapshot of COVID or county level data. So I'm going to go ahead and pull up the dashboard just to go over how to find this infographic. Okay, so here is the Johns Hopkins dashboard. So to find the infographic that has a snapshot of the county level data, you can go through this way. You can go type in the state that you want. So I'm going to use Wyoming as an example. And then it's going to pull up the list of counties in Wyoming. So I'm going to use Fremont. And once you click on the county, it's going to zoom in that state and on that county and highlight it. All right. And then you can click on that and this box will pop up. We'll scroll down and this will give you that infographic, which you will click on and it'll show up in a different window. Another way to look at county level data also is by the tribal nations map. So they've created a map where it highlights, that shows all the different tribal areas. So you can zoom in and once again I will use Fremont's example. So I'm going to go to the Wind River Reservation in Wyoming. And so you can scroll down and you'll be able to see for every tribal nation, you'll see which counties are related, so where they reside. So I'm going to click on Fremont County and it's going to pull up the COVID snapshot for this county. And so this is an interactive infographic and it also has its unique URL. So if you wanted to embed this into a report, and once you click on it, it's going to have that updated information. So over on the right, you'll see the county case data. It'll also give you a snapshot of the state data for Wyoming. Then you will see that they have a graph for the healthcare coverage as far as related to COVID-19. So if you hover over, it'll kind of break it down as far as the numbers. And then also for the population, race, ethnicity, and age graph. So if you hover over that, it'll break it down further as far as the numbers. And then it's going to show you a graph for the number of cases in the last 14 days. And then at the bottom, they have the case fatality rate. So you can actually click on this, and it'll give you how that is calculated. And then the same for the county case per 100,000. You're able to click on this, and then it's also going to give you how that is calculated also. And then also it's going to show you the number of new cases since the previous day, the population that is 65 and over, the total population in that county, people that are living in poverty in that county, the number of ICU beds, the number of licensed beds, and then also the number of staff beds. And then from there, I just have a few snapshots of the different state dashboards and kind of how they display their county level data. So this is a snapshot of the Montana dashboard for their vaccine data. So this is showing the vaccine data for Chateau County. So you're able to see that it's giving you the total doses administered, how many people have received one dose, how many people have been received both doses, doses per 1,000 people, and then also who's eligible to be vaccinated, the population that's eligible to be vaccinated in that county. And this is a snapshot of the Wyoming COVID-19 dashboard. So this is showing case data for Bighorn County. So you're able to, it's going to show you the number of lab confirmed cases since they last been updated, number of active cases, rate of lab case of confirmed cases, the number of probable cases, total number of cases recovered, lab confirmed cases that have been recovered, probable cases that's recovered, and then also the number of COVID-19 related deaths. And then going back to Montana's COVID-19 dashboard, they have also break it down as far as school level data. So in this table, it's showing you the case data broken up for elementary, middle, and high school. So it's showing you the total number of staff that tested positive, total number of students that tested positive, and the total number of cases associated with school. And then they go ahead and break it down even further. So you can filter out by county and then also by the school name. So it's going to tell you the type of school, whether it's elementary, middle, or high. And then for that specific school, it's going to let you know how many number of staff have tested positive, how many students have tested positive, total number of cases associated with that school, and then whether or not cases have been reported in the past 14 days. And then the last dashboard example I have is for the Indian Health Service COVID-19 dashboard. So for the top area, this is showing the case data for using Billings as an example. So it's letting you know the number of people that have been tested, how many people have tested positive, how many people have tested negative, and then the cumulative percent positivity rate, and then also the 7-day rolling average positivity. And then they also have a chart for the vaccination data. And then, so it's going to show you the total doses distributed, and then from that, how many total doses have been administered. And then lastly, we have put together a resource that I just wanted to go over that'll be given to you guys that has the links to all of the dashboards. So it's been filled out for Wyoming, Idaho, and Montana. So it's going to show you the COVID dashboard for Johns Hopkins, a county dashboard if there's one available for that county, also the state dashboard, and then we have linked the IHS service dashboard. So those links will take you right to that dashboard. And then also included in this Excel file is just a tab that just goes over the description of what's included in each tab in this file, why county data is important, a little information as far as the COVID-19 layer that Google Map has brought out, and then just some information on the county level mobility reports. And then you also have the tab that kind of breaks down the which states are in which HHS region and which IHS region, and then also the tribe contact info, and it'll have the website link for each tribe. So that's all I have as far as county level data. Is there any questions? If not, we can move on to our creating charts in Excel.
So for this tutorial, we will need to bring up the Excel sheet again that we were just working on, where the exercises are, and right now to go to feel free to pull up your Excel file and kind of walk through this with me as I go. So to do this, you'll see a tab called Rockville Dataset. So this data set was modified from the Fort Belknap data set, and data in this table are summarized by day. The COVID negative column here shows the number of people who were tested negative. The COVID positive column here shows the number of people who were tested positive for this day. The total test column here is just the sum, as you can see here, is the sum of these two columns, the number of people tested positive and the number of people tested negative. Similarly, the percent positivity is just just based on a calculated value. So the number of people tested positive divided by the total number of people, total number of tests. So, and these two columns here are based on, or I guess we would have to reference people COVID negative. So these numbers are based on people who were tested negative for COVID. And the symptom COVID negative means that among the people who were tested negative for COVID, how many of them had symptoms, and in this column, how many people were exposed among the negative people. So for this tutorial, we will start by selecting the data that we want to chart. So to do that, you would select this whole table here. You can just pick this spot A2. If you click on your mouse, for those of you who are not familiar, you can just drag all the way down to select the whole table. Now, if you are having trouble selecting the table, another way to do it is by using this section here. So what you can do is, since we start at A2, and then we want to select up to G92, you can also select the table by typing in A2 colon G92, and that will also select the whole table for you. So there are two ways that you can do this as far as selecting the whole table. So the next step would be to, if you look above here on the top, you would see certain words like file, home, insert, draw. So what you would need to click on is insert, because we want to insert a chart onto this Excel page. So we will click on insert here. And if you look all the way over to this section here, you will see a lot of different charting options. And this would include things like the bar chart, the line chart, pie chart, scatter plot, and a whole bunch of others that you can choose from. So for this example, we are going to create a bar chart that shows the number of COVID positive cases for each day. So we're going to click on a bar chart icon here, And you have many different options. You can do a 2D vertical bar chart or even a horizontal one. We're going to do a vertical bar chart here. And we're going to click on the first icon here under 2D columns. And this is the cluster chart. So you can click on that. And a chart will be automatically created for you that shows all the data that we just selected, like all of these columns, COVID negative, positive, total tests, and etc. And you can kind of see the legend down here that Excel automatically creates for you. But however, we only want data based on the COVID positive column because this is really, really messy. So it's kind of really hard to see. So what we would do at this point is you could either left click to bring up this selection bar here, and you could click on select data. So it doesn't matter which part you click, it should show up as select data. So click on select data. And this will bring up the select data source box. So on the left side, we have legend entries. So these are referring to all these different variables or columns that we have up here. So since we only want to see the bar chart based on the COVID positive cases, we are going to uncheck everything except for COVID plus here. So make sure you uncheck all of these other ones. So, and then once you finish unchecking this, you can click on OK. So this chart now, as you can see here, we only have a data point for the COVID positive cases, and it's in orange. And so at this point, we pretty much created our chart. And now we're going to talk about some customization you can do to this chart to make it look as nice as you would like it to be. You are the designer. You can change the title to whatever you like by clicking on the title. You can type to it. And to customize the chart, you can either double click on the chart, or you can double click on the chart, and then this place called Format Chart Area a chart design section will pop up. So there are different areas that you can customize. There's the chart area, which includes the whole chart. There's the grid line. You can customize the grid line as to how thick you want it to look, and etc. You can customize the axis. Here's the you can make this formatted to however you like this to look. Also for the x-axis and for the y-axis, you can even click on the plot area where it'll just make changes to this section here. So we are going to format the chart area. So we're going to click on here and we'll see Format Chart Area. So what we want to do is we are going to make this into a dark gray background. So we're going to go to here. We see Fill. And then we are going to do a solid fill, and it automatically changes it to dark blue, but we are going to select a dark gray background here. So it's very easy. You can change whatever pattern you like, whatever color. There are like gradient, or you can even add a picture to it. You know, this is your art piece. You can design it however you like. And as you can see here, since we changed this into a dark background, it's a little bit more difficult to see the text that we have here. So what we're going to do is we are going to go to the text option right next to the chart option that we just clicked on. So we're going to click on that. So here we're going to change our text to white so we can see it a little better. So right here under color, we are going to select white. So that will give us a white text with a dark gray background. So other things you can do with it, if you go all the way back up here again, you will see right here, there's this Add Chart Element button here. So if you click on that, it gives you more ways to kind of customize your chart. So what we're going to do is we're going to add an axis title. So in this case, we are going to do you can do a horizontal or vertical, but we're going to do a vertical at this point. So select primary vertical, and you could go and change the title to, here we have number of COVID plus. So that way we can name it to a different axis title so people would know what they're looking at. So after this point, so the next thing we're going to do, part 2, is that we are going to learn how to figure out how to do a combination plot where you can chart 2 sets of data on this bar chart that we just created. So we'll have a bar chart, and then we'll add another set of data, which will be a line chart. And then what we're going to make the line chart of, we're going to use percent positivity. So to do that, we would have to go back and right-click on this chart again. And we would need to go back to select data. And here, we would need to click on percent positivity or percent pos here, and then click OK. So now the chart is updated to show the 2 data points, COVID plus and percent positivity. At this point, because the percent positivity, because we're working off the same axis, is very low, you can barely see it on this chart. So, so what we're going to do is that we're going to change this to a line chart, and we are going to go back to right click on the chart again, and we're going to select change chart type. Here, you're going to see all the options that are available to you again as far as what chart type you want to create. We're going to go all the way down to the bottom where you see a combo chart, and that it stands for combination chart. And here you can see that both of them, you can select, for this will be the bar chart here for COVID plus. For percent positivity, it's currently a line chart. 2 different chart types, and for that, because this axis is very large for our percent positivity, we're going to give it its own axis. So we're going to make this into a secondary axis. So so the line will correlate with an axis that's displayed over here. So we're going to check this, and we'll see the percent positive here, and then the number of cases here represented by the orange bar, and the yellow line will be percent positivity. So click on OK, and here we have our combination chart. So once again, you can go over here to add chart element to, in this case, our title disappeared, so we can add a chart title above chart. You can decide. You can go up here, and then you can also add another axis title, and this one will be secondary vertical. So that way we could label it so people know which line refers to what, percent pause. And that's all there is to it. So you can kind of play around with different options and see what you like, change the color, change the titles and everything. So and yes, and also you can, like Sundek just mentioned, you can copy this chart over and just paste it into a PowerPoint if you want to present something. So just simply copy and paste. So so that is all I have for you. Do you guys have any questions? And I'm actually going to move back to the PowerPoint slide here. So so I do have an exercise for you guys to create a chart. However, we're running short of time, so this could be something that you guys could just play around with at home. And, come to us with any questions that you may have while you're working on it. Basically, we're going to create a chart based on this Rockville data set that I created or I modified. And exercise for us here. So, so the exercise will involve First, creating a new column so you can calculate the rate of COVID-19 individuals with symptoms. So the population will be 5,984. So I provided information you need to create the rate per 1,000. And then, and also I want you to create a combination chart using the bar chart as the number of individual with symptoms, and the line chart will be the rate of individuals with symptoms. So here are some additional resources that we have for you. So kind of what we talked about today, and then also examples of the dashboards that Kara showed you earlier. And I, we are very, very open. So if you have any questions or anything, you want us to help you with your data set, you want help with visualization or anything else, feel free to email us at this email address here, eocevent458@cdc.gov. We will get back to you. We could schedule a session to kind of go over your needs. So please feel free to reach out to us. We are available and very willing to help out. So thank you. Thank you for attending the session. And I'm going to turn this back over to Jennifer.
Yeah, thank you. So folks, I know that was a lot of information today, and maybe you were able to follow along with us, and maybe you might need some more time to get familiar with Excel. So what we're going to do is, I know that you're all adults, so instead of calling this homework, we're going to call it extended learning opportunity. This is an extended learning opportunity for you to play around with while you are at the office, when you have a little bit of free time. I know that a lot of you do not have a whole lot of free time, but just want to make sure that you have what you need when it comes to Excel, because those are the building blocks for just about any type of visualization that you're thinking of. So even if you were using Tableau or our Shiny app or ArcGIS, they're all based in spreadsheets, and so you need to know how to use that spreadsheet. And what we would like you to do is to go ahead and do that exercise 4 or any of the other exercises that were presented today. And then next week, we're going to come back and we're going to see how you did. And we'll have instructors who are all available to possibly break out into rooms and do breakout sessions with folks with their individual data. So that's the other thing that you can do is, how are you going to do this with your own data? What would you like to see? So yeah, that's what we're going to do the next session. And then the last session is also how we are going to be able to use other tools to post these on your own websites. And so it may be creating your own Google site. It may be using the graphs that you've chosen to post that on your Facebook site, et cetera, et cetera. So that's the future of why we're doing the Excel spreadsheets now, because you'll need them later on. We really appreciate everybody joining us today. And first thing I would like to do is kind of open the floor and say, does anybody have any type of question? So it doesn't even have to be germane to this content today. Do we have any questions for our experts here? And now's the time that I wish I had the Jeopardy music. Okay, well, we will be reaching out to you, and seeing that we have no questions and we're at 10:25, since when does a meeting get done early? We would like to say thank you so much to Sundak and to Rebecca, to Kira, to Melissa, to all of our CDC staff who were able to help us out today with this wonderful presentation. A very appreciative thanks to my colleague, Miss Erin, for going through the demonstrations for us. I really appreciate you doing that for me, hon. And thank you for all of you for joining us today. Please reach out with any questions, concerns, ideas, light bulb moments that you would like to share with us. And that's it for today. You guys all have a wonderfully blessed day. Thank you so much, and bye-bye now.